Assessing and treating psoas. Psoas is very important for consideration around the lower back and the pelvis. It attaches to all the vertebral bodies and discs of the lumbar spine, comes through the inguinal canal to attach onto the upper medial shaft of the femur. Psoas should mainly be considered as part of the anterior chain as a stabiliser and a mobiliser. It's part of your core stability system, and if muscles such as the TRA, the transversus abdominis, aren't working well, psoas can become overused. But because it attaches onto all of the segments of the lumbar spine, it can pull things out of alignment and commonly lend to common problems such as lower back pain. Assessing psoas both sides with the knees bent up to soften the abdomen, I can just place a thumb between aces and navel either side. Now, as we've seen with Chris, he has a slightly weaker TRA on the right through our pelvis assessment, and we might see one of two things. We might find that psoas is hyperactive on this side, or we may actually find that psoas on the left is overworking as the whole left side is compensating for a slightly weaker right. So let's go in and see what we can find. If I kind of place my thumb in here, I can feel that there's a lot more give on the right compared to the left. So I think it's the latter. I think we have a psoas on the left that is part of the system that's compensating for a slightly weaker right-hand side. So in terms of treatment, let's focus on the left. And two techniques that work very well are either positional release, so sinking into where I think psoas is. Chris, if you can just push your knee into my hand gently, and I can feel that contracting. And just taking hold of the leg and guiding the knee towards the chest, which should soften psoas off. And I can hold that position for 1 to 2 minutes as I feel the fascia around psoas unwinding on this side. I can also use soft tissue release, it works very well. So in this case, I'm going to find my contact again in through psoas, so I know where we are. And Chris, this time if you can just slowly slide your heel along the couch. So I'm going to use hip extension, that's it, a little bit more, all the way through to create a specific stretch on psoas. And relax, that's great. And I can hold that fixed point into psoas on stretch again for 1–1.5 minutes until I feel a release.